from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi everybody, welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about some of the newest technology for knee replacements. Our guest today is Dr. Edward Stolarski, the Medical Director of Orthopedics at Sarasota Memorial. Dr. Stolarski, thank you so much for joining us.
Thank you so much for having me. Very excited about being here.
Let's start with, what is this new smart knee implant?
So think of it like a Fitbit, but it's implanted into your knee replacement. On the bottom piece, or the tibia, there's a little receptacle for stems and whatnot. Well, a company called Canary out of Canada came up with an ingenious idea, put a little electronic package in there. That electronic package does not track you. What it tracks is your gait analysis and things like that. So the bottom line is this: we're able to partner with you and your knee and keep long-term track of your progress.
Roughly how many patients have received this smart implant at SMH so far?
With us, we're getting close to 100. That's a guesstimate. But I'm offering it to all total knee patients. Why? Because there's no downside, there's only upside. There's no cost to the patient, and there's no risks. You can get an MRI if you need an MRI. If, God forbid, you need to be shocked or something in a cardiac emergency, the knee doesn't catch on fire, it's totally benign. But what it allows us to do, not just in the short term, but in the long term, follow your progress. So think of it like this: you have your total knee done, and you're just kind of adrift, right? You don't really know what your PT gives you some feedback. You see us intermittently. We don't really know what's going on until we see you. Well, this knee will allow you to see your progress on your own app called My Mobility, and we have access to it in the office. So you come in, and we do the knee. It's a small stem that goes on the tibia. It gets activated in the OR. We finish the knee. Then when you go home, you're going to go home with a bedside box. That box is what the knee downloads at night. And it'll track the last, forget if it's 30 or 90 days of your gait in the knee that gets downloaded. And it'll keep track of it as long as you have the base station for 10 to 15 years. So in the short term, in a 90-day post-operative period, I'm going to be able to look at the number of steps taken, your cadence, your range of motion, your gait analysis. How's your walking? Are you walking with a more normal gait or not? And then analyze that and try and decide how your progress is. You'll compare your progress to yourself and to your peers in the same demographics. So you might be a little bit down. You had your knee done, you're a little beat up, and you're really a go-getter. Like, I really don't feel like I'm doing that well. Well, you can pull up your My Mobility, or when you come in, we can pull it up. And we're going to say, look, you started in the 20th percentile. Now you're in the 60th percentile for any of the metrics. You're going to feel good. Now, the other flip side to that is you think you're doing okay, and we notice something's not quite right. Well, your range of motion isn't really where it needs to be. It's a little concerning because we have to intervene earlier, and that can help us keep from missing a window of opportunity to make your progress more beneficial. So there's that short-term part where we can monitor you. Again, the implant data, not you. I'm not going to call you at Walmart and ask you to pick me up something. So the bottom line is then long-term. So say you call me 10 years after surgery. Now your knee's starting to hurt. You're having pain, and your husband says you're limping. So we can you're not going to have that box though, but we can activate the knee, and it will have kept track of 30 days of that same data. We can bring up your 90-day data and compare it, and we're looking at that gait analysis. So think of it like an EKG of the knee. And what we're trying to do is define pathologic gait with those charts. So where might be a unique gait for someone that has an infection or has a loose component or a DVT. So the next step with these implants is to put a trackable device in a gait lab on each patient. And so we'll know what their pre-op gait is, right? Then we're going to compare what their progress is for that unique individual, right? Not compared after surgery, but where they were before surgery. So I think that's interesting to see what your baseline is. The other thing we're trying to do is, say you came in with a painful total knee. Now you don't have a smart implant, you just have a painful total knee. Well, we want to take that painful total knee, diagnose what's wrong, put you in the gait lab and see what that gait is, right? So we say, okay, it looks like your femoral component's loose. Let's see how you're walking. What's your range of motion? What's your stride length? And then that becomes like the EKG for that. So remote monitoring, this is, you know, we have a lot of snowbirds, and when they leave, they're gone, right? Oh, I had my knee done 6 weeks later. I went back to Wisconsin, and now I'm having pain. Well, lo and behold, we can ship you up a base station, or you have your base station. We'll download that data. There's connectivity, even though you're, 1,000 miles away. So that is the future, and it's going to do so much more as time goes on. We're going to put it in hips, shoulders, but right now it's just knees. So kind of a long-winded answer.
Does it also serve as accountability in helping make sure patients are doing what they need to do to recover after surgery?
Absolutely. I'll give you a great example of that. So I won't violate HIPAA, but I'll say a patient that's close to Zimmer, and a friend of mine had his total knee done, and he was one of the first smart implants. And he did great. All of his numbers looked really good. Stride, length, range of motion, his cadence. But he was only taking 1,200 steps a day. Now this is way more accurate than your Fitbit or your Whoosh or whatever, because it's every heel strike it's recording. Well, I called him up. He's taking 1,200 steps a day. I'm like, what's going on? What's happening? He goes, I just don't feel like walking. I have no pain. I have no problems. I want to get back to tennis. And we had to kind of reignite his desire to go out and do things. Because what happens is, you get sedentary and that becomes your way of life. And it was like, why are you sedentary? Well, my knee hurts. Well, your knee doesn't hurt anymore. He used to be a 4-0 tennis player. So now he's like, oh yeah, no kidding. So now we're starting to get back. I never would have saw that if we didn't review the graphs and go through that. I would have said, look, in the office, you feel great, good to have a good day. So we talked more about lifestyle change and getting back into what he wanted to do in the first place. Kind of woke him up. He got woke.
Now, I spoke to the patient who was your first smart implant patient, and she said something that I found very interesting. She said that she was also able to use the app for other things like exercises that she didn't even get from PT, but helped support what was going on in PT. Have you seen that with other patients as
Absolutely.
you continue doing them?
So My Mobility, which is the Zimmer app that's associated with the total knees, is not unique to the PIQ, which is Persona IQ, which is the name of the smart implant. That the smart implant can just give its data to that. But it is a much larger platform, so we can communicate through it, right? We had a patient who was having a pain crisis and left a message in the office, but she also notified through My Mobility, and we actually responded quicker through My Mobility than number 87 on the voicemails. So that was phenomenal. And yeah, the feedback again, the exercises, there's diary stuff you can do. It really is more than just, I had my knee done.
Just to clarify, you already said we're not tracking you at Walmart, but it's not tracking also a patient's personal data or anything like that. In the age of hacking, of course, everyone's concerned of someone getting a hold of their personal data. Is that a concern here? No.
Well, first, the implant itself doesn't have GPS. It doesn't have Bluetooth or anything like that. I believe it's, and I'm getting a little technical outside my realm, but like RFID technology, which will only download to the base station. Now, listen, if they can hack the Pentagon, maybe they can hack your knee, but nobody's that interested.
SMH was the first in Florida to offer this procedure robotically. Can you explain how that works and what that really means?
So let's talk a little bit about robotically. So SMH was kind enough to partner with us and bring in the ROSA to the patient's disposal. And it's just another tool. The robot, it's not like what you see on TV where the robot's taking over for the surgeon. The robot is a tool. And it's really the analytics that I'm getting so I don't make inappropriate assumptions or wrong assumptions. So when I do a knee without the robot, I have to make assumptions that are usually correct based on experience, but they're not dialed in. So example, I'll just cut your tibia flat with a little bit of slope. Why? That's what I got, without the robot, right? So I cut the tibia flat, a little bit of slope, cut the femur in 5 degrees, what have you, put the knee together. Then I'll pie crust your ligaments to balance it. Well, in that balancing, I'm cutting a little bit, and that's going to make your knee, you won't leave the room unbalanced, but it took a lot of soft tissue work to get to that point. So the robot, what it's going to allow me to do, is going to give me data intraoperatively before I make the bony cuts to subtly make adjustments on your component positioning to balance the knee. I have to cut less soft tissue. Well, what does that mean? Your shoe fits better, right? You have all these shoes in your closet. You got shoes that fit comfortably, shoes that are uncomfortable, they're your shoes. You want the comfortable shoes. So you want something that's going to be kind of customized component positioning for you. So there's the robot's benefit. Then the smart implants is just a continuum, but also a separate entity. So I can do smart implants without the ROSA, I can do the ROSA without the smart implants, but combined, they give me preoperatively, intraoperatively, and postoperatively data that I wouldn't have had.
So you were the first at Sarasota Memorial and in the state of Florida to do this smart knee implant using it robotically. You've obviously continued to do them, so you've liked the procedure. What excited you about the smart knee implant and doing that robotically? Why do you do that?
So I was an electrical engineer before I went into this. So I like data, I like processes, and I like objective feedback. So before these technologies, we would do a total knee, and what we were measuring, which really wasn't good enough, their range of motion, and looking at their x-rays, and saying you should be satisfied with that, you have no pain, has been replaced with, and remember, only one in five of those people were unhappy anyway, which we don't like, right? So when you combine the smart implants and ROSA and the data that gives me, it gives me better, more normal feeling knees. So there's a thing called joint awareness. When you first have your knee replaced, you are very aware. And our goal is over time, and it may be a year, but over time you forget you had that knee done and it's back to feeling more native and natural. That wasn't true in the past, it was very mechanical. But as we utilize technology to give you a more natural, balanced, and flowing range of motion, we are going to go from 80% to as close to 100% as we could get. So I guess the bottom line is if we were at 100% with satisfaction and outcome, we wouldn't need the robot, we wouldn't need smart implants because everything's wonderful. It's not that way.
Are there any added risks with the robotic surgery or the Persona IQ smart implant that patients should be aware of if they choose to use that?
It's a great question. So with the robot, it's the technology is such that I have to make 2 additional incisions. So you'll have your incision for your knee. It's pretty small. But I have to make 2 incisions, one on your thigh and one on your tibia soft tissues. Within those incisions go 2 pins. Those pins are fixed, and then there's an array. That array is attached, and that's what the robot sees in space when you're obtaining your data points. Well, if you get an infection, you get a pin site infection, which you wouldn't have gotten if you didn't have the pin sites. I haven't seen that yet, but it makes sense that would be a risk. The only other risk is if you have a really high trauma where you probably would have broke your femur anyway, got hit by a car, had a real bad collision, you could break at those pin sites until they fill in. They're only 3.2 millimeters, but you asked me a question, I want to be direct. That would be the only 2 things I could think of if you were probably going to break your femur anyway, and if you got an infection. I have not seen any infections, and I can't think of anyone that's broken anything. But anyway, those are things I worry about, and I try and have that discussion with everyone. Then the other question is, do the benefits outweigh the risk? And I think they do, because again, a better outcome and low risk. Now the smart implants, zero risk. I really racked my brain trying to think of something that could go awry. There is nothing.
Why do you think it's so important that these newer technologies that you often hear about at very large academic medical centers throughout the country, why do you think it's important that they're available at a community hospital like Sarasota Memorial?
Well, I'll toot Sarasota's horn. We provide every single facet of care and orthopedics that you would get at Mayo or Cleveland Clinic, and I really think that's a testament to the hospital's administration and the people that join the team here, from the circulator to the scrub techs, everyone. So if you look at what I do, I'm a referral center for complicated revisions, infections, that's the other part of my practice. Why wouldn't I bring the technology and help lead that technology? So you can consider this an academic center. Actually, we're looking at this year bringing on a fellow so we can pass some of the knowledge down.
And how important is it that it's available to this patient population?
Florida, in particular Sarasota, there's an attraction of athletic outdoor people. So, you know, my oldest knee replacement was 94. She took 1 medicine, and that was for Alzheimer's. That's why she did the knee. No, I'm kidding. She took one medicine, otherwise very healthy, and she did great with the knee. This area really attracts active people that want to stay active, and that's why it's important to bring that technology. They deserve it.
Is there anything else you want patients to know about robotic surgery and this smart knee implant if they're considering it?
So it really has to be done by a person who has done quite a few, because the learning curve is there. Not for the smart implants, there's no learning curve for that, but for the robot there's a learning curve. And we had talked a little bit before the show about golf clubs, and you can give me Tiger Woods golf clubs and I will still do poorly in golf until I've mastered golf. Then those clubs make a difference. It's the same with the robot. If you don't know the basic tenets of doing a total knee replacement without the robot, you can actually get yourself probably in trouble if you don't incorporate that base knowledge. So the robot to me is a tool to help make me better. It does not replace me. And the smart implants are a tool to help me monitor you and you monitor you, so that we can intervene if there's any poor things happening. So you really should. I don't see a downside when you get down to it. There's certainly no downside to smart implants, and there's very few indications where I would not do the robot.
Dr. Stolarski, thank you so much for being with us today. And as always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.